Hi, my name is Ingrid Dominguez, and in this video I will be showing you how to use the AED properly, or at least the way that I learned it in the emergency responsive classes. Because I do not have an AED myself, we're going to be using this box as a prop in the way to show what the AED looks like, because from what I've seen, AEDs are usually in red boxes, so that's why I'm going to use this as an example. When a patient or a person is around at the time that they have fallen and you've seen that something's going on, you always have to make sure that the person is unresponsive whatsoever. That means they're not talking, they're not breathing, they're not moving, not flinching, nothing. Because if you use an AED on a person who is still breathing, who is still able to move their fingers at least, it could not only injure them, but it could cause them way more damage than what they already probably have by now. So the first thing you do is you always make sure, like by trying to moving the person, trying to hear their breathing or seeing if they're breathing, you make sure that they're unresponsive. And once you confirm that they're unresponsive, you could try to do CPR first. But if you see that the CPR is not working whatsoever, that's when whoever is around you during the clinic time, you tell them, oh, can you go get me the AED? And there's another person who you would tell call 911. So once the 911 is being called and the person who ran to get AED is back with it, you place the AED on the floor and you make sure that person is straight flat on the floor. So in the AED, usually it has paddles, like sticky paddles that are placed on the chest area, and on the paddles it usually has a picture format of where it needs to be placed. So you always place them where it shows it needs to be at. And once you place them there, it comes with wires that is connected to the AED box. And in the AED box, usually it has a button right here around the area, and you press it. So once you press it, the AED will tell you steps of what to do. Usually, the first thing it does is say analyzing shock. And when it's trying to either analyze the shock or it does the shock, you have to make sure everyone who's around has no hands on top of the patient, because you could get hurt yourself. So when it says analyzing shock or shocked done, your hands have to be up in the air, and until it gives you further notice of giving CPR compressions, then that's when you could do it. So always make sure that you have to listen to what the AED says first, and once it's done doing what it tells you to do, it will tell you to do CPR, and you do the CPR as long as it tells you to do. And once you hear it again one more time, say analyzing shock, hands up in the air, and let it do its thing, and it's going to tell you when the shock was analyzed. And usually you will see the patient kind of push forward up a little, and that's how you know the shock was given. And again, CPR, and until a more professional person like the ambulance people come, that's when you have to not stop, but let them assess while you're still continuing what to do. And once they've taken over, the AED is taken off, and that's when the situation is done. And that is how you properly use the AED when there's a situation of a person who is unconscious. But always make sure that the patient or the person has to be unconscious completely, like no responding or anything, like I said as earlier, because again, you will hurt the person more than what they're already hurting, and then you could get a lawsuit at the time as well once the person is already completely hurt and all that. But that's what you do for AED.